for having me. My name is Latifa Venus, and I'm an obstetrician gynecologist at Vincent Pilati Hospital. We are definitely doula friendly and we welcome them with open arms. A doula's role is extremely important to me because it not only supports the patient, but there's an extra emotional support component that I feel can often be lacking in a clinical setting. As an obstetrician, it's not always easy to be with the patient all the time. There is commitments throughout the day that need to be met. And a large proportion or a large component of labor is extremely emotional. And just having the support of the doula there is very important. And that's often what I discuss in my antenatal class, antenatal sessions with our patients, is that they should definitely consider doula for that support, because sometimes patients can feel quite isolated and on their own during the labor process. And as we know, it can take a long time because we are quite pro-natural. Natural means natural. So it does take quite a long time in certain instances. And this is where I find that the doula role is quite critical. Because they can encourage the patient and reassure the patient and support the patient and their partner, and prevent that alienation and isolation type of feeling where they feel that they aren't being supported completely. And I think that just being the obstetrician that is quite pro-natural myself, I try not to intervene and I try not to overstep. So I would come in to reassess the patient and check, but because we're trying to be more pro-natural, we do wait for longer periods of time. So we try not to necessarily be quite clinical about it. And that is also where I find that I really enjoy working with doulas, because they do keep the patients quite relaxed and occupied, and they take them for walks and they can advocate for them as well. They can say, okay, I think maybe we should ask the doctor to discuss some analgesia with you, or and I often find that husbands can be quite frazzled by the whole experience, and that's also where a doula really is quite helpful, to just have that third person there to be supportive, because sometimes the husband is quite forgotten. So I've so far been very happy working with all the doulas that I have, and I think that it's quite a good symbiotic relationship. Yeah. I feel that support companion is necessary in labor, whether it is a natural birth or whether it is a cesarean section. I still think that the support is there. Sorry, I should correct myself and say it's necessary in pregnancy. Delivering is just one part of pregnancy. I think a lot of the emotions and the postpartum blues and the struggling with breastfeeding starts to kick in afterwards. And it's not necessarily just a natural transition to motherhood. It's quite a life-changing experience. And a Caesar in itself is not a natural process. So it can come with quite a lot of emotional, physical implications that patients may not have anticipated. And again, to have somebody there in an emotional capacity to reassure the patient, to express to them what is normal, what is abnormal, for patients to express how they're feeling, and to have somebody there to help them work through those emotions that come along with postpartum, the postpartum period. Also assisting with breastfeeding or helping to get a lactation specialist or advocating for the patient again, I think it is very helpful. And just having again that supportive companion, especially in an emergency setting when the patients end up in emergency theatre. It's often not necessarily the way the patient had anticipated the delivery to go. And because patients can be quite affected or traumatized by the whole process if it happens quite quickly, if there's an emergency, if the baby is distressed. It's a life-changing, life-altering period. And sometimes patients are slightly overlooked, or sometimes the emotional needs haven't been met, and everyone's preoccupied with rushing to make sure that the baby's okay. But I think it's very important to understand that mom and dad are there. So even in that setting, I find it really helpful. You just have somebody there just purely supporting the parents and while I try and be as supportive as I can, and I really do make an effort to be there emotionally for my patients, it does relieve me quite a bit knowing that there is somebody else. I'm quite empathic myself, so I'm very happy to know that there's somebody that's there just for that role. So be it labor, be it a cesarean section, whether it's elective or emergency, I think it depends on the patient that you have and how much support they need in that space. I really love working with doulas because it's so pure-natural, and because I let the labors go on and on because the patients want to wait. It really takes the stress off me. It really does. Because I feel like I want to sit with the patients, but I can't. Like I physically can't be there. I have to be in theatre or seeing my antenates. So it is. So I'm very grateful, and I'm very jealous that they get those foot massages, and I just have to watch them. But in terms of doulas being in a hospital setting, so a hospital is quite a regulated clinical environment, and we are governed by many rules. Doulas need to bear in mind that we are in a very high risk profession with high indemnity, and certain rules need to be followed. And even though we do make exceptions here and there, I think that it's very important to understand that the obstetrician is the one that needs to make the final decisions. And because we have proven that we are pro-natural, I think that our decisions need to be respected, and doulas also need to be able to advocate for us with the patient because we would be acting in the best interest of the patients. Rules are rules for a reason. They are there to make sure that everything functions correctly. And while we want a beautiful, pro-natural, and what the patient wants to experience, we also want a good outcome with a good, with a healthy baby and a happy mom. I think when doulas do step into the hospital, they must become familiar with the hospital, the rules, the staff. They should try and garner good relationships, a good open communication, and avoiding confrontation is always great for the team. I generally think most people work really well with everybody, but I think it's important that we all understand our roles in terms of getting the patient the experience that they want. And I would suggest to doulas maybe to just reach out to the obstetricians that they're working with, maybe pop into the labor ward so that they understand and know who the sisters are, know what and what isn't expected of them. And I think that once that trust and that relationship is built, then it actually just becomes a great team to work in.
Murray, and I'm a gynae in private practice. I'm at Vincent Pallotti Hospital. I've been there for about 4 years now. We have a practice, especially my practice is very obstetric driven. I do gynecology, but much of my time is taken up by obstetrics. I do consider myself a pro-natural gynae, but I think that the better term, or the term that I often use, is pro-choice, and also sometimes just I like to practice what I hope is good, decent obstetrics. So it would be taking into account patients' preferences, patients' wishes to birth normally or vaginally, keeping birth a more physiological and natural process and an over-medicalized process, and making decisions with clear medical indications, which is where I sort of talk about good common sense obstetrics. So we'll do what has to be done, dictated by how the labor progresses. And of course, the patient's wishes filter very heavily into that. I don't have anything against a Caesar, but many patients would like a Caesar. Some patients, request that. But I do have an issue with interventions that are not necessary and are perhaps done with not always the correct reasons, or not reasons that are not made clear. There's a difference between an emergency and obviously a clear obstetric problem, which isn't always a screaming emergency, and something that's not an emergency. And I really feel that I try to include the patient in the decision making. That's not always completely possible in the setting of labor. Some people aren't always that able to make decisions. but to understand my reasoning and my concerns and let their opinions count. I mean, I don't ever really want to walk into a labor room and sort of have this approach of saying, you must do this because I said so, unless there's an enormous problem. Sometimes that means giving more time or doing something that maybe might not be my first choice, just so that we all feel we've given everyone the right chance and enough time. And at the end of the day, I want someone to be at peace with their birth. So if we do end up having a cesarean section that wasn't the plan, that at least everyone knows why it was done and what the reason was, and that it wasn't something that was necessarily rushed or pushed onto somebody. So that's what I try and do. And sometimes I think that leads a little bit of uncertainty, because patients, although they want to make their own decisions, sometimes they feel a bit lost when there's choice. I find that some patients actually want a little bit of a stronger approach, but that's how I practice most of the time. I do enjoy working with doulas. I find that doulas, I mean, they obviously play an enormous role before, during, and after the birth. And I mean, it's not just for that short time where I might see them. I think a lot of the work that's done is before the birth, where the patient is actually much more prepared for the birth, is more confident. She feels safer, she feels empowered. And I think just having that person you can speak to at all hours and you're able to WhatsApp and, keep in touch with as your labor starts is really important. Because a lot of patients who don't have doulas, you find when they come into the hospital, they're sort of wide eyes. They don't know they're there too early or they're there too late. They don't know. And I think a patient with a doula seems to just kind of start the process more in the know. Obviously, during the labor, the doula is very much supportive in terms of supporting the mother, physically, emotionally, psychologically, and the father, of course, as well, helping them navigate what is obviously something that's very new to them. I mean, many women haven't been in, most women, or, a large proportion wouldn't have labored before. The hospital's a strange place. These are healthy women. They're not used to hospitals, helping them navigate all of that, maybe talk them through the uncertainties. And yes, keep the birth more physiological by encouraging them to move around, change positions, how to naturally manage their pain relief, how to sort of stay strong and stay in the labor. And also advocate on their behalf. I mean, maybe not always in terms of when it's strict medical decisions, but certainly be able to remind the patient that this is what we planned and this is what, and just to be another voice for a patient who doesn't have a very strong voice when she's in pain and she's in labor. And of course, obviously afterwards, so much help with the baby and bonding and support and debriefing and talking through the birth. Like my patients with doulas, they just come prepared and they just come calm. And I think that preparation is huge. At about 28-ish weeks, usually 24, 28, depending on how anxious the patient is to start thinking about the birth, I'll always bring up an antenatal class. I almost insist someone does something, even if they do some online course, or they just watch YouTube videos, and I try and direct them to ones I've heard are better than others. But I'm trying to get everyone to have an antenatal course of sorts, and I bring the issue of doula up with everyone. And most people are, maybe it's also the kind of clients that we have in our practice. Most people already are very familiar with a doula. And there's a couple that sort of look at me a bit strangely and don't know what I'm talking about. And I sort of speak a little bit and I say, we'll do some antenatal preparation, it can come up, and if it doesn't, we'll chat some more. You want a doula to, be obviously on board with the birth plan and advocate for the patient, but also to have an open mind and be able to help the patient accept when their birth plan changes. I find that I found this at Origin, everybody there obviously was very, very geared towards a natural birth. And I never want a patient who finds she needs an epidural or to find she needs a Caesar feel that she's giving up, or that it was a bad decision, or that she was weaker, or she didn't fight hard enough. So I think I would like the doulas to be supportive in all eventualities and have the patient prepared for whatever labor might bring. I mean, a patient who needs an epidural is by no means failing. And I mean, I don't see it so much in my practice now, but at Vincent Pilati, when I was at Origin, I used to see patients who were just going into theatre and they were just so absolutely crushed, and it was the end of the world. And I mean, at the end of the day, we're doing a surgery that hopefully was done with good intention for mom and baby. And I think that an open-minded approach. I mean, I know it's not just healthy mom, healthy baby, where how you get there is important too, but you also need to make safe decisions. It's safe, we never know what would happen if we made different decisions. So if you just need to practice as a team and be open to change was the one thing. And the other thing is, recently I worked with a doula who is a bereavement doula, and I've had 2 births with her. Well, one was a termination with severe abnormalities, and the other was a baby who was an intrauterine death, or it was about 24 weeks or so, and I bought the same doula. And that doula played an enormous role. And I sort of think hopefully I won't have many more of these, but going forward, if I were to have any cases like that with the loss of a baby, I think I would very, very strongly say that a doula should be involved, because she just made the process, she was just so respectful of the process and the birth, and took the mementos and supported mom and dad so very like stoically and through it. And it's a time when everyone's so emotional, and she was just so calm in the face of it. And I mean, it made an enormous difference. And that's a role I hadn't necessarily thought of before. But yes, very important. Especially, I think, if you're dealing in government hospitals and hospitals where you're not always dealing with good outcomes. And I mean, there's enough to deal with the uncertainty of a hospital and pain and all the rest, and then to not have a baby at the end of it. I mean, to have someone in that supportive capacity, I think is critical.
I'm Dr. Salma Isaacs. Thank you very much for the invite, Charlene and Wom. I'm a practicing obstetrics and gynecology doctor at Chris Barnard Memorial Hospital in Cape Town. And I'm a very pro-naturalist obstetrician. I'm probably one of the few that's left in Cape Town. So thank you for the invite. So maybe I should just give you a little bit of my understanding and background to why I actually encourage my patients to have doulas. It's probably vastly related to where it all started when we worked in the state service. We were directly involved in the original studies done on doulas and the value of doulas in the setting of single mums. And so I was part of a huge group of practicing, sort of at the time, learning gynecologists at Mowbray Maternity Hospital. And I could see the value of having doula support in the setting of mums that didn't have partners. So that's where we originally looked at the studies. Doulas have obviously taken off, and it's taken on a different sort of, I would call it, face in the last, say, decade. We now encourage doula accompaniment right through your pregnancy, and especially at the time of your birth, if you were going for your natural birth. Unfortunately, the doula's position gets slightly compromised. I would call it compromised when we need to take the patient for an emergency cesarean, because then obviously the clinical setting changes, and perhaps in that setting, even the doula might, in a way, sort of hang around the theatre and wait till we're done and then come on board again once the baby's birthed. So there's value in the doula even in that setting, because they help with breastfeeding and the support for the mum. So in that sense, that's my sort of understanding of what the doula position is in my practice. At Chris Barnard, we do allow doulas in. At Mediclinic, we also deliver babies. We also allow doulas in, and that's been hospital policy all through COVID. It was a bit dodgy, but now that COVID's over, doulas are very welcomed. So I think, remember, as gynecologists, we often take for granted that we don't spend 24 hours with a patient. And often our midwives and the doulas play that pivotal role in support for mums that are going through a very prolonged labor. And so in that sense, I think the role of the doula is definitely not something that I take lightly. In fact, the emotional support often helps a lot with pain management in the patients. It builds their confidence whilst they're in labor. It often is a security almost measure for the dads to be, and that helps to calm the mum. If the dad's calm, often the mum's calm. And so I think the doula's got a very important role to play in that sense. Certainly, I don't think the doula's job ends and starts in the labor ward. In fact, I think the role begins way before that. And so the relationship rapport that gets established prior to the actual delivery day is actually when we follow up the patients and we suggest they have a doula accompany them through the pregnancy of 9 months, build up a rapport and understand what the role of the doula is, which is very important because lots of women know about the word doula, but they actually don't know the functioning of the doula. So education is important, like these type of interactions are important. But far more important than that is also the post-birth role of the doula. And I think in our setting, as you asked me, what is the role? I think there's a real importance to a doula in many aspects for the mother, dad, and the situation in that they're there to support the mum in labor whilst the doctor is in and out, whilst the midwife is popping in and out. Because remember, in the private setting, the midwife often is basically looking after maybe 2 to 3 patients in labor at any given moment. So their attention is not 100% necessarily honed in on the mum, although they are very wary and aware of the clinical setting with CTGs being monitored, etc. So from that clinical aspect, there's definite monitoring happening, even if the midwife's not standing at the bedside. But the doula who stands by the bedside, I think functions 100% of the time and is there from the start of the labor and right through till the birthing happens. I don't ever discourage normal birth. I think so. One thing one must remember that a lot of unfortunate percentages get thrown around about cesareans. And I think if mums walk, and this is my message to all mums to be, if mums walk into labor ward and believe they can do this, which they can, in other words, have a successful normal birth, it largely depends on the psyche of that mum. And a doula is literally one that would reinforce that in many aspects. I think the question is, all of us in the team that's caring for the mum have got limitations. And I think that's very important. So in the court of law, unfortunately, medical legally, the gynecologist or attending doctor or attending midwife in charge of the labor or the birth is unfortunately the sole sort of provider in that sense. And the doula's position never changes because their position is support. And they needn't take on the clinical aspects of being in that labor room. I think what's very important is to know your limitations as a doula and create that necessary calm environment, which is, I believe, the function of a doula. At the end of the day, I think when things go horribly pear-shaped, I think the buck stops with the person caring for the patient as the primary clinician. That could be a midwife, it could be the gynecologist or obstetrician, but certainly one needs to know where your position lies in the team. And I think if you understand that as the doula, your participation is largely building the rapport before the build-up to the birth, being there as a support for both mother and dad in the birth, I think then you're an excellent doula. And I think lots of people can fit into that scope of practice as long as they don't step over those boundaries. I think that's important because often maybe experience and what people have seen, they often try and extrapolate that into what they're seeing in a current sort of situation with a mum and dad or a mum in labor. And so they can get that sort of clinical setting wrong because they're not directly involved in clinical management, and that can be quite sticky. So I think what's important not to step on toes and to be respected as a doula and to be sort of understand our positions all in the team. I think a good doula is one that acts almost in a way silently but present.
Okay, so I'm Dr. Catherine Elliott. I'm an OBGYN. I'm at Christian Barnard Hospital in Cape Town. And part of my practice, more than 60% of my practice, is maternal fetal medicine. So I'm a maternal fetal medicine specialist, and that looks at all the specialized scans that we do in pregnancy. It looks at high-risk pregnancies, manages moms that have potentially medical problems, and there's also a fetal part, fetal diagnosis and scanning as part of my practice. And I've been doing this for a number of years. I enjoy my job. And I think the question of whether to have a doula in the delivery room comes up quite often. And I think we all know that labor is an intensely life-changing experience. There are many anxieties that come into it. particularly what will happen when I have or deliver my baby, in whichever way that is. And there are a multitude of anxieties around, am I going to be a good parent? What's going to happen? Is this process going to be safe? Something going to happen to me or my baby? So all of these things are part of the thought process. And we know that building relationships with your caregivers and getting support is one of the most important things. So removing the fear from the process can facilitate the process. And this is probably where doulas come in. So it's not the only person or only caregiver who helps in this way. So the medical personnel who are helping and caring for the patient during this process and the family during this process are also very important. And we know from medical history that over the years, everybody's had a birth attendant. So if you look through medical history, you'll see that there were people who were trained to be birth attendants all the way through medical history, and they were called to attend to women in labor. And we also know that supporting women in labor is very important. So in fact, can actually change, well, not change, but support the natural course of labor when the woman feels supported. And it doesn't even need to be someone that she knows. It needs to be someone who is exclusively supporting her during the process. So in terms of doulas, they play a very, very important role in the support of women in labor. And in our setting, where we are privileged to have many different caregivers supporting that woman, and women normally or usually have a birth partner as well, they can get that support from many different areas. But in the terms of the doula, they provide expertise. And one of the most important things probably is telling the client or the couple or the family what to expect and what's normal. And I think that can remove a lot of fear from the process. So from my side, we are very happy to see doulas in our labor ward. I leave it up to the couple's choice as to whether they would like to engage with a doula and have a doula as a support process there. And I do stress one important fact, which I am quite careful to express every single time, is that in my mind, a doula has a very big role in supporting the process of labor, and particularly a natural vaginal delivery or a normal vaginal delivery in what we call medically, but they don't necessarily have the same medical training that the medical personnel have. And there are two different roles, and you need both. So it's important to rely on your medical personnel for the answers to the medical problems, and the doula for the support and the sometimes very long hours of support in the labor process. But I do leave it up to the couple and their choice and what they would like, how they would look, what they want that day to look like. It is a close relationship, so you need to feel comfortable with the person who's going to be in the room with you. And then I've seen doulas really change a situation. So relax the couple dramatically so that the fear is taken out, so that the room becomes a peaceful space again that can accommodate labor. I've seen doulas facilitate a process that then goes very well because the couple feels supported. And there are various different techniques that doulas have for pain relief, so massage and etc. And I'm speaking without knowledge here because I'm a lay person in this realm. But in terms of what they can do with massage and heat and water and things like that, we would definitely not discourage couples from having a doula, but I wouldn't say it is a requirement. It's up to the couple to have that person in that space. I'd like to just add that I did a talk on cesarean sections many years ago, and it was quite fun actually. And one of the things that came up was that cesarean section is the oldest known operation. So second oldest operation known to man. The first one was a battlefield amputation to stop someone bleeding to death on the battlefield. And the second one was a cesarean section. So from 2000 plus years ago, people were realizing that babies didn't always come out through the vagina. And at great cost to mother and baby, people were cutting babies out of women's abdomens. So we've developed a bit since then. But a Caesar was necessary then, and it may still be necessary now, which doesn't mean that the support of the doula is null and void. It just means that the course of the labor has gone differently, and the procedure will be different. I mean, I'd like to say to women that this feeling of something's going to happen to me without my knowledge or consent is really an ongoing, subtle thing, that fear that women have. And I really think that it's an unnecessary fear. You have your wits about you. You're a strong, independent woman running businesses, running homes, looking after elderly parents. I mean, there's no reason why you can't be in control in your own labor, and not, you don't need to feel that things are happening to you without you being the person who says yes or no.
My name is Clarice Tigeri. I am a medical doctor, but more focused on the entrepreneurial side of medicine and healthcare. All right. So I graduated in Cape Town, UCT. I did my internship in ComServe in Johannesburg. I then moved to Louis-Trichardt to join my parents at the hospital that they co-founded. So they established this hospital in 2013. We are currently a 12-bed hospital. We have an 86-bed license, and we are in our second phase of expansion. In this expansion, we'll have a theatre. We'll be the first hospital in the district. We have an adult and neonatal ICU. So the concept of birthing companions, I guess, had started, from when the hospital actually started, but, the staff here weren't actually doulas, right? The thinking and idea behind it was when patients came in labor, especially those that didn't have a partner, we had ward attendants who would basically accompany the patients, talk to them, ensure that they have, enough food and water, and, someone to actually just talk to throughout the labor process. And I think then from there, patients actually enjoy those services. And last year, we started looking into having the ward attendants trained to actually become doulas. So that, we could basically expand on that offering. I will say, one of the reasons why patients actually enjoy coming to us is that they know that, when they're here, they won't be alone in labor. And for the most part, we generally tend to have a very low cesarean section rate compared to the number of doctors. So I think one could attribute it to having an obs and gynae who actually believes in NVDs and not necessarily pushing for Caesars. But, I think one could actually also attribute it to, the patients themselves. So, through having the support, they're more willing to actually continue with having a normal delivery as opposed to opting for cesarean section at whichever point. So I think the benefits are there. The benefits are clear from a clinical standpoint, but also from the patient's standpoint, because ultimately, it really is about that mother's experience and that mother's journey.
Hi, everybody. I'm Sister Angela Wakeford, independent midwife in Cape Town. I have been a midwife for 30 years now. I trained here in Cape Town and worked here for a while, and then I worked in the UK for 15 years, and then I've been back in independent practice in Cape Town since 2010. At this stage, I am only doing out-of-hospital births, home births, and take on about 4 or 5 clients a month for home births. So that's kind of me. So yeah, midwifery is very much who I am. Absolutely, doulas are welcome. I actually encourage my home birth clients to hire a doula so they have that known extra support. And the couple and the midwife and the doula, we are the birth team. We each have our role, and I find it nicer to work with a doula through active labor than on my own. If something gets tough, and sometimes it's very useful to have that other voice to also support the mom. It can be really lovely. So, before the baby's born, we have a meetup all together, as the birth team at the client's home, so we can discuss the ins and outs of where they're going to think about birthing and where we're going to put the birth pool and when they're going to call us. So, and anything that they want or don't want specifically during the labor and birth, and we meet the dogs and cats and children so everybody becomes familiar with us. So yeah, I mean, my experiences of working with doulas have only been positive. So a midwife is a trained medical profession, and we are there not only to emotionally support the couple and practically, but most importantly to maintain safety. That I feel is my biggest role. I know, that is what my skills are. As a midwife. A doula is a woman who has been trained to give non-medical birth support to the couple. So we work hand in hand. We might be that the woman needs to hold on to her partner and have him or her right in front of her, but she still needs her back massaged and sips of water given, and I need to listen into the baby's heartbeat or write some notes or move, so that's how we can all work together to support the laboring women. I have this little story about a birth that I did with a wonderful doula, and we're quite different. I'm very practical and realistic, and not so into visualization and things. And the mum was just having that, I don't know if I can do this anymore, little wobble just before starting pushing. And the doula, found a flower and put it in front of her face and said, imagine yourself opening like the flower. And I said, eat some banana for energy. So we came from the different aspects in different ways supporting that mom. So yes, we have a good joke about bananas now. I think that's the difference, is that it's my role to keep an eye on the safety and to make sure that the labor is progressing, and maybe suggest changes like change of position or in or out of the birth pool or something. That's more my role to suggest those things. We also know the clients well. We have a relationship with them as well, separate from the relationship that the doula has with them. We just want what's best for them. And it's very important that we are a cohesive team. I prefer to have doulas who are quite experienced, because if we do have to deal with a complication, you do sometimes need their assistance, not to do anything medical, but I need to be able to say, we need to get her out the pool now, or pass me this or pass me that. So that will help if the doula knows what I'm talking about. So that's an extra safety thing. So I do like to work with known doulas who are experienced. Sometimes people will say to me, well, I got a friend who's a doula or whatever, but she's just trained or something. I'm very happy to have that person there, but I would also want an experienced doula as an assistant for the actual birth. I've done quite a lot of births in private hospitals as an independent midwife, and it's still lovely to have the doula there, so that if you do need to pop out the room and go and find this or find that, you're not left without support. And you don't have to call in a hospital staff member as much, because you've got that doula there to help them as well as yourself. And just having known care providers rather than a stranger, who you haven't met before, is clearly shown in the research that it's beneficial to the moms and to the family, and it enhances the positive outcomes of birth.
My name is Susan, and I am a midwife. I trained about 42 years ago and have worked in a number of different birth environments, ranging from birth centers to hospitals to home. Currently, I'm exclusively a home birth midwife and practice in the southern suburbs of Cape Town. As far as I can remember, and I stand to be corrected, but the concept of doula, a doula within the team of women that look after, or the team of people who look after pregnant and laboring women, probably came onto my landscape about 20 years ago or so. There's been a slow but steady increase of doulas into the team that care for pregnant women and laboring and postpartum women. Up until that point, the midwife pretty much used to play and provide both roles. The care provider taking care of the medical side of the woman in her pregnancy and her birth, as well as the psychological and other support role, comfort support role for that woman. And so initially it felt a little bit strange for me to have to modify my role in the labor, especially, and make space for a additional person who is specifically only there to provide the supportive, psychological supportive role for that mother. And I think for a lot of midwives of my generation, the space opened up slowly, and more we began to see that doulas were only a positive addition, in as much as they certainly did help support the midwife as well as the mother and her partner in labor, and that the entire responsibility of all aspects of labor care didn't fall squarely on the shoulders of the midwife. So as more and more doulas gained experience and started working with midwives, we began, myself especially, to see just that role could be expanded and that more support for women could be offered in addition to what the midwife herself. So it did take a little bit of that pressure off, which was fantastic. As far as I'm concerned, always happy to have a doula in my birth space, in the mother's birth space. And 95% of the time, I find that doulas are absolutely just a very, very welcome addition to the support that a woman should be afforded. What are my expectations of a doula? Well, I would very much expect that the doula has a number of antenatal consultations with the mother, pregnancy meetups to get to know her, to get to know what her expectations are, what her fears are, and how she sees the doula's support role for her, and how that might differ from the midwife's role. So definitely I expect the doula to have knowledge of that mother, and also then to know how to give that additional support as it relates to different birth positions, different homeopathic remedies, the use of aromatherapy oils, the use of sort of physical support like counter pressure, and assisting the mother into a position that's going to enhance the flow of her labor. Also to know from a kind of verbal point of view what language to use around her, what is useful, what is not useful. And then, of course, not to ever forget the role that the doula can play for that birthing woman's partner, because very often this is an experience that person is also very unfamiliar with. And I sort of believe that it does make sense that the role of a doula is most valuable and probably sought out most often in mothers having their first babies. Obviously, it's a completely unknown road for them, and they definitely reach out to get as much support for that unknown journey as possible. And thereafter, once a mother has had a really good experience with a doula, she often feels like she wants to try and repeat that in a second birth, or she feels that based on how the labor was for her in her first labor, she may not need as much support second time round as before. So I do find that it's the majority of first-time mothers, and I do actively encourage first-time mothers to seriously consider having a doula added into all the people that are there for her on the day. And of course, postpartum as well, not to forget that there is a huge role for postpartum care from a doula that I think has become quite specialized now into exclusive postpartum doulas. I think for me, one of the most important components of a good doula is that on the day she has situational awareness, because as much as we can talk about what a mother may or may not need in labor, as the hours roll by and as the labor unfolds, we can never know what might come up for that mother. And she needs to be able to read what is going on and modify her care and modify what has been spoken about antenatally to actually what the mother needs in the moment as each hour unfolds. I think it's really important for doulas to remember that she's not trying to achieve her best birth, but she's there to support the mother's best birth. And sometimes we forget why we're there, and we have an idea as to how that birth should unfold and what we would like to see happening. But it's really, really ultimately about what the mother needs. And she may change her mind entirely. Things she thought she would need are not appropriate for her, and things she didn't even know she needed become appropriate. So that situational awareness for me is what makes the difference between a sensitive doula and somebody who is just trying to apply one recipe to every single birth situation. And then, of course, so often the partner is needing to be debriefed and to be spoken to and to have the whole labor situation normalized, because so often he or she is seeing a birth unfold for the first time as well. And often we underestimate that a woman in labor can look very different to the woman that is known to that person in her pregnancy. So support to the whole family. And also the doula can be a gatekeeper to that mother's environment. So often in the name of support, the bigger family or friends or community are wanting to intrude on a woman's labor environment. And I do see the doula being a gatekeeper to help protect the woman from overexposure to too many outside environmental factors which only distract from the sensitivity that is needed for that woman in labor.